Hey guys, Dr. John Montoya, and I wanted to give you a COVID office opening update. First off, thank you everyone for your patience on waiting for us to get everything in place to open back up the office. Things are going to look a lot different in the office for a little while, and we don't know when the regulations are going to change to where they're going to kind of loosen up a little bit on the PPE or the personal protection equipment that we're going to have to be using. But the first things first is we want to make sure that everybody is safe when they come into the office. So we're going to be dressed different, we're going to be gowned different, and we are going to be wrapping the office a little bit different. We're going to ask everybody to stay in their cars. Just call the office and let us know that you're there, and then we're going to, when we're ready for you, we'll call you up. Maybe somebody will come down and get you to get you to your appointment. We'll be asking you some COVID screening questions on, symptoms. Have you been feeling any symptoms? Having a fever? We're going to do take your temperatures with a touchless thermometer. Just kind of wave it in front of your forehead. And then all the staff is going to be wearing protective equipment and changing that in between each patient, as far as gowns and caps and face shields and those sort of things. We're also putting in medical grade HEPA filters in the office. Now, I bought 8 different units. One of the units can clear out a 2,400 square foot facility in 15 minutes. It filters down to 0.01 microns, which is the same size as a virus, as a COVID virus. So we're going to be turning the air around in the office at least every 15 minutes, most likely more, with all those units. We're gonna have one in the waiting room. We're gonna have one in the back of the office. We're gonna have one in each treatment room. So with that, I mean, we're gonna constantly be cycling the air through the office. We're shooting for the 11th to open back up. Somebody will be in the office this coming week, calling patients to get their appointments in. We're going to ask you to, really honor our schedule because we're really limiting things to one patient at a time. So we're going to make sure that people keep their appointments if they're coming in. And, again, we want to make sure that our patient population is safe and healthy, and that our employees are safe and healthy. We miss you guys. We look forward to seeing you, but we want to make sure that we're doing everything right before we open up. And we're waiting for some of that equipment to come back in, and when it does, we're going to open.